That's the prescription for today. Today's presentation is on addressing toxic stress and mental health in communities. And a wonderful headline of their presentation is Trauma-Informed Care, the Importance of Connection. And I wanted just a little brief background on our presenters. Blythe Foster, she's worked in behavioral health, in the behavioral health field since 2013. She's currently a recovery specialist for Kern Behavioral Health and Recovery Services, where she provides case management services for youth and young adults ages 16 to 25. She has a BS and a master's in psychology and has experience in providing case management and behavior replacement services to children and young adults in school, clinic, and community settings. Belinda Vieyra is a licensed clinical social worker. She's a transitional age youth team supervisor at Kern Behavioral Health and Recovery Services. She's worked in the behavioral health and social services field since 2005. She has a master's in sociology and in social work and has experience providing behavioral health and social services to children, families, youth, and adults. And Belinda and Blythe, I will now turn it over to you. Take it away.
Thank you. Good morning, everyone. So I am Blythe Foster, and then this is my awesome supervisor, Belinda.
Very nice to meet you all. Thank you for joining us today. So when we were discussing what we were going to talk about, we were like, wow, there's so much to cover and we only have about an hour. So we started thinking about what is the most important thing that we wanted you all to take away. And that was the importance of connection. So today's learning objectives are: why is connection important? How to improve interaction with trauma survivors, connection on meso and macro levels as well, behavioral health resources available, and where to access additional training for mental health intervention. So we will not be covering mental health interventions today. The time just doesn't permit for that. We will be referring to them. However, if you'd like a full mental health intervention training, we will provide you more information on how you can register for that. So today we will also be referring to transition age youth primarily that we work with in our program, because that is our area of expertise. So the T team, the transition age youth team, is comprised of mostly current and former foster youth, including youth who are also on probation or youth that are experiencing homelessness. So these are youth from ages 16 to 25. And these youth have complex trauma and are a high risk population. We feel this is relevant for your learning because our youth's experiences, they have experience navigating multiple systems, which many of the people that you work with also have that. They have challenges to accessing resources and addressing their trauma. And these valuable lessons, I feel, are applicable across various socioeconomic backgrounds, ethnic groups, and so forth. And also their lived experiences and are similar to other groups that also experience high levels of toxic stress. So we will be referencing this population primarily. However, again, we feel that this information is you can generalize it to a wide group of individuals. And so I don't know if there's anything else you want to add, Blythe?
No, that is great. So, so what we're going to do here now is we're going to share with you guys a video, and I know that you guys have been hearing a little bit already about toxic stress and some trauma. So this video is just going to be a little snapshot before we get into the more detailed about how we deal with that after. So let me just, all right, here we go.
You know the old saying, don't judge a book by its cover? Well, the same is true when you assess a patient. Hi, I'm Dr. Cruz. Early in my career, I noticed a pattern with some of my patients. They often had multiple health issues, were uneasy during office visits, and frequently visited the emergency department. But worst of all, they never got better despite multiple visits. Then I realized something. From an early age, many of my patients were exposed to trauma and adverse childhood experiences, or ACEs. This includes emotional, sexual, or physical abuse, violence, neglect, discrimination, poverty, and other adverse events. ACEs are more common in the US than you'd think. In fact, 60% of US adults have one ACE, 25% have 3 or more ACEs, and 16% have 4 or more. ACEs occur in all socioeconomic groups, but are more common in low-income and minority populations. For young children, repeated exposure to trauma can impact brain development and literally rewire the brain's response to stress. So as they grow up, many struggle with issues related to emotional regulation, like depression, anxiety, or substance use disorders. Trauma survivors are also more often at risk for chronic diseases, behavioral health problems, and even suicide. Knowing all this, I began to rethink my approach to care. Instead of asking patients, "What's wrong with you?" I ask, "What happened to you?" Recognizing that life experiences are often a root cause of poor health is integral to improving patient care. Trauma-informed care has helped me take these experiences into account, providing greater insight into my patients' needs and how to address them. Here are 5 key ways that healthcare organizations can gradually integrate trauma-informed care into their practices to help patients and staff. First, build awareness and generate buy-in. Involve both staff and patients in adopting a trauma-informed approach. Second, invest in a trauma-informed workforce. Hire staff that embrace trauma-informed care and provide training not only for clinical staff, but also for non-clinical employees like front desk workers or security guards, who are often the face of your organization. Next, create an environment that is safe and welcoming for patients and staff. Engage patients in meaningful ways. Ask how they feel and listen. You can also build trust by involving them in their own treatment planning. Finally, identify and treat trauma. Consider a screening approach that works for your patients and ensure that treatments and referral sources are available. These changes take time, but each step improves our ability to connect with and care for patients. Today, our patients appreciate the changes we've made. Plus, our staff is more in tune with patients, so work is less stressful and more rewarding. Trauma-informed care. It can truly transform the caregiving experience from being treaters to being healers.
All right, that was an awesome video, wasn't it?
Yes, and thank you, Kevin, for putting the link. So for those of you that didn't catch it, Kevin put some of you asked for the link to the video and he put it in the chat. So
Yes, so with that said, that video is just like an overall snapshot. And so each agency kind of does this a little bit differently. For example, the county, we have certain screeners and different things that we use. So not everywhere is the same, but everyone can use trauma-informed care, right?
So what we primarily wanted to focus on today is connection. So this is a quote from Brene Brown. Connection is the energy that exists between people when they feel seen, heard, and valued, when they give and receive without judgment, and when they derive sustenance and strength from the relationship. So the biggest takeaway that I would like for you to have today is like the value of connection and the helping relationship. So many times when we get into the work that we're doing, we have certain requirements and a ton of paperwork that we have to do. And I would argue that's probably for everyone on this call, has that anyone working in direct service, whether it be whatever, from a variety of different organizations. And so what's really important is to really try to connect with the people that you're serving in order for them to feel like they're actually seen, heard, and valued. So making sure that you're taking the time to actually listen and to be present. And so sometimes we're not present in what we're doing. And if we're not completely present, like the people we're serving, they know that. They can like pick up on that. And for our youth, for example, who have suffered a lot, or who are survivors of a lot of complex trauma that they've experienced in their lives, they have actually given us feedback and said, as a way of survival, I have learned to really assess very quickly who I can trust and who I cannot trust. And it's almost instant because many of our youth had to meet a lot of people. They had multiple houses that they lived in. They had various social workers, other service providers, whether they were receiving mental health services or a variety of different things, right? So they interacted with lots of people. And many times they also had to change like schools, for example. So there's constant change going on. And so I would argue that many of us do this like very quickly, but if you have had trauma that has occurred, then there's also this very quick assessment that you're doing when you're meeting people to see, are they trustworthy? So it's not just like what we're doing, it's how we're doing it. So please focus on like being very present and ensuring that you are actually connecting with the people that you're working with. I don't know if you have anything to add, Blythe.
No, that was perfect. So, which leads directly into the next thing that we were going to talk to you guys about, which is why is engagement so important? So, engagement is how we develop that trust with the individual that we work with. And even if you're not in a clinical setting, but you're in a mentorship or you just are building rapport with just somebody that's struggling. Again, these things can be generalized, as Belinda said, but specifically, a lot of times you're going to hear us talk about in relation to our work and what we do with our young adults. So it builds that trust. So when I'm engaging with somebody, I'm ultimately working to develop a professional working relationship with this individual, but I'm not walking in like, okay, you need a job, let's go get you a job. So we walk in and we work on engagement first. And if the individual trusts me, they're more likely to tell me like, hey, I didn't go to that job interview because one time when I was there, X, Y, and Z happened, or I'm really nervous to actually talk to somebody, or, whatever the case may be, we may see as resistance, but actually there's an underlying reason. So without that engagement piece, without them being able to trust me, they're not going to share with me why they need assistance and where they need it at. And so how do you do engagement? How do you create engagement? And patience is the starting. Patience with the individual and patience with yourself. You're not always going to get it right the first time, or it might take a really long time and we might mess up, right? Everyone does. I don't to this day do everything right with every client. And I'm like, well, gosh, really messed that one up. Time to try again. So the patience piece and understanding of where, everything that could have and may have happened to this individual, and it's not a reflection of how they feel about you necessarily. And so that also has to do with the other qualitative features of interaction, things that we can't necessarily measure, things of how you talk to other people. I've always been a talker, right? That's something that I'm natural with, but I constantly have to make sure and check myself, because if I had a bad morning, I'm probably bringing it to work. So taking a moment to make sure that I am, like Belinda said, present, and that what I am showing the individual that's in front of me is what I want them to see. I want them to see that I am a calm person. I want them to see that I'm someone they can trust, that they can talk to. And I'm not trying to fool them. I'm actually being this person. That's the difference, right? I am coming to this service, or I'm coming to this individual with the full intention of wanting to hear them, wanting to learn about them, and wanting to help them. Did you want to add anything here, Belinda, before I move on?
I just wanted to say, like, regarding the trusting relationship, when you've experienced so much trauma, especially when you've had that trust violated, it is really difficult for you to trust people. And so it is of the utmost importance that you work very hard to develop that trust. And with the youth that we work with, oftentimes they will reject us. They will push us away. They will not answer our phone calls. They will be very cautious until they're sure that we are trustworthy. And so how do we demonstrate that trust? We like what Blythe said, our authenticity and what we bring to the relationship, as well as following through with what we say we're going to do. So like, if we say that we're going to be there tomorrow at 3, that's exactly what time we show up. If we say we're going to help you with this task, then that's exactly what we're going to do. And so then the youth that we work with, they start building more trust. And then I'm very proud to say that on our team, like, they have their individual people, however many of them associate our entire team with being trustworthy. So it's one of our values that we hold very dear, and we try to ensure that we don't ever violate that trust, because when people have experienced trauma, they need to be able to trust before we can be effective with any interventions that we have, no matter how sophisticated they are and how perfect they could be for that situation. If they don't trust us, then we're not going to be effective with them.
Yes, which reminds me, Belinda had been talking about this. One of the things that our team does is, even if it's not something they want to hear, we have full disclosure as far as, within reason, with certain exceptions, of course. We even tell them if we have to file a CPS report. This isn't a comfortable thing to do, but we are working to have trust with these individuals, and we're going to be right there when they fall, even if, they're a young adult that has their own kiddo removed. We're going to help them through the process of getting that kiddo back. So our thoughts on it on the T team have always been that we have full disclosure with them, like, hey, we've explained this to you. This is what has to happen. This is what's going to happen. And we're going to be right here to help you through it. And you'd be surprised at how many times they've just appreciated that, and it just helped to build the trust even more. So it's easy thing. Go ahead.
I'm sorry, I wanted to jump in and ask a quick question. With this, knowing that oftentimes from your very first meeting or your very first phone call with these youth, that they're coming into it automatically with a distrust. How many do you get a feel for how long it takes to build that relationship? How many meetings, how many phone calls? What is a reasonable expectation for them to open up and let you in?
Do you want to answer that, Blythe?
That's a very tough one to answer, but that's a very good question. So there is no set amount of time. It depends on the person. It depends on the situation that they've been through. It depends on the team, the support that they have. Sometimes they have a lot more than us. And so sometimes we have a lot more angles that we're working in, a lot more consistency in building that trust. However, I would say that especially with somebody that is coming in resistant like that, if you're just working on engagement and you're not getting down to business yet, you can tell when they're ready, and you can tell by when they start talking back and when they start engaging pleasantly rather than resisting you. And so you just kind of know, but there's no set amount of time.
Yeah, it's going to vary depending on their level of distrust. So it reminds me of this young man that we're currently working with right now. And we have our intake process here at Kern Behavioral, where we do an assessment, treatment plan, and a ton of paperwork in order to get someone into services. And like, I had to go out to the STRTP, so that's formerly known as group homes, 4 times to just talk, to just be like, hey, how's it going? What are some of your goals? How can we help you? So that's not always like the norm, but like by saying, I'm just saying sometimes I think for that individual, it took us probably about like a month to having almost daily contact with him before he started to really open up. And so again, it's just going to vary. And when someone starts telling you their story, that's when you know that you've developed the trust, because you have been deemed worthy to have the honor of having someone share with them what has happened to them, what their fears are, what they're anxious about, what triggers them, what brings about their depression. And so when someone starts to open up and share their story, that's when the trust has been formed. And obviously we're mental health providers, so that not necessarily be as applicable if you're not a mental health provider, because maybe they don't go that in depth with their trauma, for example, with everyone that they're serving. However, it's going to be part of the way that they're interacting, and returning your phone calls, allowing you to help them, following through with whatever you recommend. Then that you're building that trust because they believe in what you guys are doing, your partnership. So once you've developed that partnership, regardless of what it might be at your different organizations, then you'll know, okay, I've made it. I made some inroads into building that trust.
Yes, agreed. And great point that depending on your role in the kiddo's life, that will determine too, because we get a lot that were put into mental health services when they didn't want them when they were younger. And so now that they are doing it, maybe because they know they need it, but they still don't want it and they're still not sure because they had to do it as a kiddo. Sometimes it takes us a little bit longer to get them to really engage in the actual mental health of it rather than the resources of it.
We had a question in the chat as well before you move on, regarding establishing this engagement. How important do you feel the setting is? We used to do a lot more home visits pre-pandemic. Now we've done a lot more phone, curbside, office, park, etc. Some more private than others. We've tried it all. Any thoughts on the best settings to develop trust?
That's a good one. Our team especially, and I think we're really proud of this, we go everywhere. And I think that the variety is actually the best. If they don't feel comfortable talking in their house because there's someone else that lives there and they want to talk about that person, or they're having conflict with that person, then we don't meet at their house. We meet in the county car, we go for a walk, or we take them to the park. And also depending on what you're working on, if you're helping somebody who's really struggling with like social anxiety, then maybe you are going out in the community and maybe you're helping them through something, and that's what's building that engagement too. But the initial one, it's just wherever they're comfortable at. We always ask them if we're scheduling even an assessment, if they want to come to the office or they want to do it at home, wherever they are more comfortable, that's where we go. And that, I think, being able to choose is more important than actually where it is.
You know, as the TABE program for the transitional aged youth in providing the housing for them, the benefit that they have from being able to work with the team that Belinda and Blythe have is just tremendous. I think I looked the other day and about 1/3 of our young adults take advantage of that. And they're young adults, so they can choose, they don't have to. So, and we know that that's a really hard age group to keep engaged with. And so the skills and the tools that that the team you guys have is just tremendous. And I see it on a daily basis. I'm very grateful for you guys.
Thank you. And likewise, Wendy. It really takes the whole community to really support people who have experienced trauma. Okay, so this is one, just full disclosure, I'm a huge Brene Brown fan. Read all her books, listen to all her podcasts. She's also a social worker like me, or I'm a social worker like her. So definitely love her. So I'm going to show you another video here from Brene Brown. And this is the empathy versus sympathy. So as we listen to this video, I just want you to think, just a little self-evaluation, like, do I use empathy or do I use sympathy when interacting with people, possibly who are telling us some pretty traumatic things? Because not only in mental health do we hear people's stories, it can come up in a variety of different locations, and that might be where you make a referral to programs such as ours. So again, I'm going to play it now. You just kind of do a little self-evaluation.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with "at least." And we do it all the time, because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now, I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
So many times we do try to silver lining it, as she made up that word, but we will look at the silver lining. And sometimes when people have shared their story with us, we try to make it better because we're uncomfortable with that. So it's important to be comfortable with not having all the answers when you're working with someone who has experienced a significant amount of trauma, and to be able to listen and to empathize and not sympathize, and not necessarily try to make it all better. Because as we know, and I'm sure what you've learned so far in this conference and what you'll continue to learn, like, it's so much more complex than that. And so really being able to connect and allow someone, and again, be very present when they share whatever it is that they want to share with you is really important in just being there. I don't know if there's anything else you want to add, Blythe.
No, oh, sorry. I was trying to play it again. No, I second all of that, because I think that until you're in that situation, of course, you can never really anticipate how you're going to react. I'll just say that. But I would say that being comfortable not knowing what to say. I used to struggle, like, in my mind, like, oh my gosh, I need to know, like, as they're saying it, like, I need to think about what I'm going to say or what I'm going to do. And sometimes it's okay to not say anything, to not do anything, and just let them keep talking, and maybe, just be there with them and like, hey, I know, you're crying right now. I just want to let you know, I'm just going to sit here. That's okay too. So just being there with them, and then afterwards they're like, oh my gosh, I feel so much better. And you're like, really? It worked?
Yeah, definitely. And then sometimes when we try to like silver lining it, we're dismissive and they feel like they're not validated. And so we want to validate their experiences. So if for some reason and I'm guilty of this. I've done this before in my life. I haven't always been a therapist. When you try to kind of fix it, like just be mindful of that as you work with people, that that's not how it works, and that's not always helpful, and can actually make them feel like their experience isn't valid, which would not be helpful at all.
Yes, yeah, which leads into this. So how do we connect with trauma survivors when they experience behavior problems? Because sometimes the first time we know that somebody has had so much trauma or so much toxic stress in their life, right? We see it outwardly. We see it because somebody is cutting class a lot or started using a substance. And not to say that it's always correlated with something, but however, a lot of times that's when people catch it because something's going on with kiddo, because someone's acting different. We're just seeing some signs, some changes. So how we handle that, how we go about that, is very important and very crucial at an early age. I would say the earlier the better to start handling this correctly. And I don't think anyone ever means to shame someone. And I don't think anyone, ever means to personally feel shame, right? But sometimes that's what happens to kiddos. So the difference between reinforcing shame or supporting positive behavior change. Okay, so shame is when somebody feels like they are bad. They are not able to separate their behavior from themselves. Well, I did this because I'm bad. They genuinely feel this way. So the result of that is that they don't feel like they're worthy of making a connection. They don't feel like they're worthy of anyone's love, of anyone's support. And then they get stuck in this little hole where they don't ever make change. They never come back up out of it. That can change though, right? If we reframe that to guilt. Guilt is even though it might not feel good to us, it's actually more positive because it helps us to drive and change our behavior. When you're feeling guilty, you're recognizing that you behaved a certain way. You're able to recognize that that was inappropriate or the wrong way to handle something. And you're able to learn from that and say, I feel uncomfortable because I did this and I want to behave differently. It's inconsistent with our values, right? And so when we're working with a population, however little or however big, the way you're going to frame it, the way you're going to do this is going to be differently. And looking at this mostly will happen in therapy at the, age level that we work with. However, how I handle it when a young adult tells me something like, they can't go in a certain area because they're going to get in a fight because that's just what they do. I can handle that by how I respond to that, right? I can handle that by okay, so that has happened. This is, I'm isolating and it's a behavior. It happened. This incident happened, but I'm not saying oh yeah, you get in fights, right? So how you respond to them is the most important thing. And then they can start to work towards feeling guilty and changing their behavior. Belinda, did you want to add anything from the therapist point of view?
No, I think you covered it all very well.
Thank you.
So we're going to go over some of our transition to independence process model, which is an evidence-supported practice that Blythe and I are both trained in. It's one of the models that we used in our program when working with transition age youth. So one of the elements is engagers. So these are qualitative features of interactions for engaging youth and young adults. It really comes down to the approach. And I would argue that this isn't just young adults, but people of all ages. I know when I go to my primary care physician, who's awesome, we have a conversation. He remembers things about me, and it's not this in and out process where here's your prescription, have a good life. It's actually a conversation. And even when he's disagreed with some of the decisions that I've made, he doesn't judge me for it. And so in the same way, when we're working with our youth, we have to be mindful of how we're engaging and how we're interacting. So it's not just what we say, it's how we say it. So all of our nonverbals as well, we need to consider that. And this is how we encourage the sharing of thoughts, feelings, and ideas. So one of the things that is fundamental to engagement, especially with young adults, is having a casual conversation. So if they feel like you're too formal or too professional in your approach, they're not going to want to talk to you. If you ask them so many questions that they feel interrogated, this is like one of the number one complaints that I get as a supervisor when somebody asks too many questions. They're like, man, will they just chill out and just like calm down with all these questions? I feel like I'm being interrogated. And so these are some of the lessons that we've learned from listening, right? Like actually being present and listening to what helps us to connect with people. So many times when we've had youth or other people who have experienced trauma, they oftentimes will engage in high-risk behaviors. And some of them are very scary. And our knee-jerk reaction, we want to just tell them, stop doing that. Like, you can't do this because of this reason and that reason and that reason. So then we go into lecturing mode, which is incredibly ineffective. So be aware that using a non-judgmental approach and avoiding lecturing is more effective. So we want to make sure that all of our nonverbals, like we're giving good eye contact. One of the things that some of our youth have told us is they don't like people taking too many notes. Again, that formality, right? So sometimes when we have paperwork, we get really caught up in like making sure we fill it all out. But remember, we have like another person on the other side who's like trying to tell us about them and what they need. And you don't really feel heard if people are not making good eye contact or more focused on completing paperwork than actually having a conversation with you. So just a helpful tip in terms of engagement, making sure that it is more of a conversation, that it is more casual, similar to, like we have boundaries, professional boundaries that we have to follow, which Blythe talked about as well. But we need to have the approach be very similar to what individuals have with their peer group. And I would argue that's at any age. It's just more comfortable that way. So we want to ask open-ended questions, give affirmations, right? We want to reinforce desirable behaviors, give very descriptive praise in order to have whoever we're working with continue to do what it is that we think will be beneficial to lead them towards their goals. And again, empathy and concern and encouragement. And so when we are addressing a concern, for example, you can say, I really care about what might happen to you. And I am concerned that some of these things might not be so safe. So can we talk a little bit about what you could do differently in order to stay safe? Is that okay? So kind of also asking permission. So sometimes when we're the helpers, we just feel like we're like the expert and we need to tell people how to live and tell people what to do. So I encourage you to use a different approach, one that demonstrates respect, regardless of what age group you're working with. Respect is really critical. So if some of you are working with very young children, you can also demonstrate respect to them. Just because they're children doesn't mean they don't deserve that. And so with young people, that is also important. If you are working with young people, it's important to talk to them and not just talk to the older adults that are in the room. So I have worked with children, young children, and oftentimes it's like just the parent, you know, or a teenager, especially if they're a teenager. Make sure you include the teenager in the conversation. You're making eye contact with them. Like this is about them. So the conversation should also be directed towards them, not just about them. And reflections are important. So this is from motivational interviewing. So if you're not currently trained in motivational interviewing, I strongly recommend that you do. I think that would be beneficial for everyone on this, all of our participants, because if you ask just questions and questions and questions, it can feel very intimidating. And some of our clients get angry actually if they're asked too many questions. And so by using reflections, you can obtain information, you can elicit information from individuals without having to ask so many questions necessarily. So it's more of a conversational approach, like a formal, like as if you were with your friend at lunch and you're just talking. And so using that more casual approach is oftentimes more engaging. And so then summary statements are also important to summarize everything that's been discussed, making sure you're on the same page. So also with reflections, you do that as well to make sure that you're getting the accurate information and that you're understanding, and it conveys like, I'm listening to you, I'm understanding what you're saying, I'm fully aware of what your needs are, and then offering assistance if necessary. So don't assume, always offer. It just is very respectful to offer, like, instead of saying, oh, you should go do this, you should go get linked to this program in the community that's going to help you with that need. A different approach might be, there's this program that I think would be very beneficial. Can I tell you a little bit about it? And then you tell them, and then you ask them, is there something that you would be interested in? And can I help you with that? And so then that's different. So I don't know if there's anything you want to add, Blythe.
No, that's great. Yeah. So what we also wanted to touch on, and I won't go into detail, I'm sure most of you have seen this pyramid or something similar, but when we're engaging and getting to know our young adults, one of the things we stop and pause on is strengths discovery and needs assessment. I like to know where each of my individuals that I'm working with is at, what they're good at, and ways that I can help them. I'm constantly using that conversation to get to know this. Maybe they mentioned something, and then I don't have to stop right there when they mention it. Maybe they just mentioned that they really want a job, and then they kind of gloss over it, and I can circle back to it later. But I'm looking also for those strength things that they're good at, like, oh yeah, I met somebody at the park today, and like we struck up a conversation. Okay, like he's good with communication. You know, I'm just making mental note of this so I can use it for later. I'm putting in a little mental note toolbox. I'm not taking notes. I'm just being present, listening to the young adult, and I'm keeping this in mind. But the interesting thing Belinda and I were talking about that you see with people who have experienced a lot of stress, a lot of trauma, is that sometimes they don't necessarily fall specifically into this pyramid. Sometimes they don't check off the physiological needs first. I mean, the basic ones, right? Putting food and water into their body, but sometimes rather than sleep, they would rather go and be with a friend that needs them. I was up all night and I was doing this, and, you know, I don't know when I'm going to sleep. I'm supposed to work today, you know, yada, yada. We'll notice that they will put their needs last for somebody else. The relationships will sometimes be very important. Sometimes they will decline housing because they want to have their animal with them, and they can't have their animal at any of the housings that are available. So they will, you know, deny themselves a shelter because that connection with that pet is more important to them, that relationship. So it's very important that even though we understand that everyone needs food to survive and everyone needs shelter, and everyone, you know, eventually is going to need employment to sustain that and stuff, that we're also keeping in mind the individual and what's important to them and where they're at and what they want to work on. Because if I'm trying to get them a job because I'm like, realistically, where are you going to live? How are you going to afford all this stuff? But that's not what they're wanting, then I just broke that connection because we're working on two different pathways. So, if anyone has any questions, go ahead and ask them. I'm going to jump ahead because we're, you know, getting close to the end. So I want to be respectful of everyone's time, but I know I kind of glossed over that a little fast.
So how do we build connections in the communities or at system levels? We help people who are experiencing a significant amount of toxic stress by helping them to build social supports. Social supports are critical with individuals being able to overcome toxic stress within their communities. So if they are very socially isolated, they might not be able to have their community support them. So one of the things that we do also is like help our youth to build social supports. Why are social supports so important? Because we share resources, things such as childcare, temporary housing, financial support, such as microloans, emotional support, attending NAAA meetings, for example, is another way that we help people to build communities. And also our collaboratives. So we have Wendy here from Aspirinet. We love Aspirinet. They're one of our partners, and together we help support transitional age youth. And so community collaboratives are very important. We have the Dream Center for our youth, and that is very critical in helping our youth to manage toxic stress. So what are some of the things that are offered? Things such as shelter, housing, jobs, childcare, physical health care, behavioral health, and food, just to name a few, as well as an opportunity to develop those connections. What is needed policies that support equal access to basic needs that alleviate toxic stress caused by trauma. So as mentioned in the first video, toxic stress exists in many communities. However, it's much more prevalent in communities that have less access to resources.
Yes. So Kern Behavioral Health, for example, offers a variety of services. This is just some of the things like individual and group therapy, individual and group rehabilitation, substance use, all the medication services with the psychiatrist, including the evaluations and then ongoing medication support, employment, housing, and just case management in general, and then crisis services and specialty services. So the county offers quite a bit, and on our TAY team, we offer quite a lot of that in-house in our own even employment program and everything that we've been piloting, and it's just been going so well.
I don't know if we're going to have time for this video, Blythe. We might have to move on.
Okay, so real fast, Kevin or Patty, can one of you post the link into the chat? Because I would love for people to, okay, Kevin's on it. So I would love for you guys to watch this one. I know Belinda spoke very highly. Some of these videos are just, Rita is amazing. I've watched this video working with Belinda. I've heard and watched a lot of her stuff. So please watch it in your spare time. It is great about, you know, kids needing a champion, and I think it will sit well with all of the community partners.
So for those of you who are interested in more training, I saw one, but I just kind of glanced at it, but it sounded like some people present were interested in further training. Like what, so not all of you are mental health clinicians, and that's a wonderful thing, because we need all of you in the community in order to help alleviate toxic stress in our communities, and we all do our part. And so we have this training, this wonderful training at Kern Behavioral Health. It's youth mental health first aid training. And can we put Noe's email in the chat? So if you're interested in getting additional training on mental health first aid, this will help you to recognize the signs and symptoms of early onset of mental health challenges and provide you with some tools in order to intervene with someone who shows up at your office, and perhaps you're offering a non-mental health based service and then they need mental health support. This training will equip you with being able to intervene. And then a referral to Kern Behavioral or a different mental health provider might be necessary. And this training will, again, equip you to be able to do all of that. And I think that's all we had.
Yes, and then here is our contact information. If you guys have any questions about any of this stuff, feel free to reach out to us. And then Belinda had kind of mentioned it a little bit ago, but the TIP model that we use is transition to independence process. And so it's also a training. I'm one of the trainers. So that is available to some, and the same for Noah, the email. You could also ask about that and how to sign up for that if you're interested, but it's kind of a blend of like motivational interviewing techniques and solution focused, and like the strengths discovery and needs assessment is an actual a little more structured. They teach you how to do it in that training, and it just gives you a variety of tools and tips and tricks that you could use if you work directly with kids and young adults. So does anyone have any questions for us?
Yeah, please, we still have a couple of minutes left if folks want to throw another question in the chat. A great presentation. I feel like I was kind of blown away, to be honest, with the number of participants who joined this meeting. It's over half of the people who have tuned in. So I think you two are amongst friends and colleagues that handle this type of stuff and work directly with people. There were several questions about the trainings, about trainings that may be available. So I kind of wanted you to, if you could kind of fill in some blanks on that. I mean, how much time does your agency spend training other agencies or other partners? And, what kind of variety of trainings may be available? There's been tons of questions this morning so far on how this applies in school settings. In fact, one of the questions here was about school settings and possibly training teachers. So if you could just touch briefly upon what kind of trainings may be available for folks.
Well, I'll start with just saying that for as far as the mental health first aid is like a great first to go to if you're not already set up. Some of the partner agencies I know are already set up with like accessing the county for trainings and stuff. When we do have certain trainings, they'll normally put out flyers for them and to the different agencies. So, and I think Kern Behavioral, like we do a lot of internal trainings, obviously, but we have started to branch out and really including the community because, they recognize that educating everyone is very important. So Belinda, do you know specifically more than that as far as what's available?
There are several trainings, as Blythe mentioned, the transition independence process model. We actually do offer that to Kern Probation, Department of Human Services, Kern High, Kern Superintendent of Schools. If you are interested in the transition to independence process model training, which, as Blythe mentioned, reviews a variety of core practices and guidelines and the theoretical framework of how to work effectively with transition age youth, you can email me and I can get you more information. We offer this training every quarter. And as Blythe had already mentioned, mental health first training is offered to the community. And so if you reach out to Noe and that you are interested in having your organization trained, he can provide you more. He's in charge of that training, for example. He's also with our training department. We offer so many different trainings, whether it's therapeutic models, if you're a therapist, whether it's cultural trainings for cultural competency, working with diverse groups. We offer trainings for the LGBTQ community to become more familiar and how to be effective and respectful. I mean, I could go on and on. It's just a wide range of training. So probably what would be the easiest thing is if you email me and you tell me specifically what your training needs are, I will connect you to the right person who can get your organization trained. Because it's pretty much anything and everything you could think of, I'm sure we have a training for it, at least one, if not 10. So, yeah.
Wonderful. There's a lot of thank yous and great jobs listed in the chat right now. So I'll let you two thumb through those and really just tremendous presentation. Really appreciate your time and all the information that you're willing to share. So thank you very much. And do you have any closing thoughts before I seize the microphone and kick everybody out of the Zoom room right now?
I just want to thank everyone for everything they do for the community. It really does take like a multi-agency approach to really address toxic stress in our communities. So as workers in this field, we oftentimes don't get thanked. So I just want to thank all of you for everything that you do for all the people that you serve. I saw some people's names pop up and you all help our TAE clients and we are very appreciative for you. So, and thank you for joining us today.
Thank you so much. I know I got a couple that the chat's going really fast. Somebody or a couple people direct messaged me, but if you wrote down our contact information, if you could reach out to me by email for that very specific question, I will absolutely talk to you about that.
Right. And any questions that didn't get answered, I know that there were a bunch in the HUVA. I think a lot of them were covered throughout the course of the presentation, but we have record of those. And we also have record of the Zoom questions that were put up in the chat. If you private message somebody, those messages will go bye-bye for our records. So write down Belinda and Blythe's contact information and feel free to reach out to them directly or reach out to either Patty or I, and we can forward any kind of information or further questions that you have. So really appreciate it. tremendous work. Thank you so much for the great response for those who tuned into this session. Like I said, I'm sure this was the biggest session out of the 4 groups, so really appreciate that. Again, there's more available on the Whova app, including their entire PowerPoint presentation. If you didn't jot down or catch those video links, those are in there. So if you have access to the Whova the presentation is in Whova, if you have it either on your desktop or on your mobile device as well. So you can also continue to post new questions in the community tab also. Once you leave here, don't forget to join the exhibitor live Q&A. You can also go into the virtual booths as well, where some of our partners have put information up, pictures, flyers, other collateral. Those are not manned. The exhibitor live Q&A is, and I think we probably have about a dozen, maybe more, agencies that are planning to participate in that exhibitor Q&A. So check it out. Thanks for tuning in. Thanks to our presenters. And enjoy your lunch, everybody. And hopefully everyone's enjoying the rest of the conference. Thank you so much.
Bye. Have a good day, guys.
Bye. Thank you. Thank you, Kevin and Patty.
Yes, thank you, Kevin and Patty.